The idea of healthy folks, quote unquote healthy folks, or those folks that don't have any underlying conditions previously, that the idea that if you're healthy, you don't need to get vaccinated. How would you respond to that?
This Delta variant is nasty. This bugger is nasty. It spreads quicker, faster, and it hits people harder. Early on, we didn't see much young people getting hit by COVID, certainly not really getting hospitalized at the rates we're seeing. But with the Delta variant, we're seeing them younger and healthier getting into the hospital. So this Delta variant is a different animal, and we want to be very cautious. So whatever you thought about this virus, it's a different playing field now with the Delta variant.
When we kind of navigate through the logic and the thinking of whether we should get vaccinated or not, some folks think that I've already gotten the virus. I've already experienced the illness, and I've lived through it, and my body's built the antibodies, and I don't need the vaccine anymore. What do you feel the medical field's response to that would be?
Well, of course, we would encourage them still to get vaccinated. They still need to get vaccinated because we believe that the immunity that you get from the vaccination is better than the immunity you would get from having had COVID-19 or the virus that causes that. Now, it's a tough question, because there's so much individual differences in how people respond to viruses. And so people think, if I had it already, I've developed the antibodies and all this to ward it off. That's questionable, right? Because individual differences and so much different things. But what's safe is probably getting vaccinated because we know the science behind that, we know the research. And again, we encourage people to talk to their physician, talk to their kauka if they have any concerns.
I hear a lot about just certain studies that are coming out, and some of the most influential ones that I've heard about are the studies that are currently coming out of Israel. Like large studies of those that have already encountered the illness, get one dose of the vaccination, and turns them into, build super immunity, and there are other studies out there. What have you heard, and how do you address what's being spread now?
Yeah, there's a lot of good studies out there that are showing that getting vaccination really does protect you. And even if you had COVID before, having the vaccination, like you said, just can only enhance that and make it stronger. And the studies showing that the vaccination is the best way, right? But there's been, people are finding, like they do on social media and other ways, finding other people claiming to have done research or are doing research, but are still in the infancy stage of that research, still not quite at a place where we can rely, either the sample size or number of participants are small, hasn't gone through peer review, or the methods aren't as rigorous. So we have to look at the source. Again. Err on the side of safety and being safe, talk to your physicians, talk to the experts.
It's interesting that you bring that up, the idea of social media or the internet, and being able to go into these conversations and these threads to see the perspective and what people are thinking. It does take us into a place where there is a fear for the affecting of DNA, the potential, kind of circling back to that first issue brought up of mistrust for government. But what is actually taking place, how microchipping and other long-term effects that can come from things like this.
Yeah, glad you asked that, Kalehua, because it's really interesting, We have a mistrust for government. We're not even listening to the scientists and physicians, the experts, but we're listening to strangers over social media and whatever they're posting from somebody else, perhaps from Russia, China, or whatever, right? So we gotta be careful. There's trolls out there. There's people that are just putting information, putting their thoughts, their opinions, not facts, out there, right? So you gotta really be of that, really be cautious. Look to the source. Where's it coming from? And we gotta think about our responsibility to each other, whether we wanna spread that kind of information without some factual basis. But the point is, there's people out there that mean to do harm to others. They want to throw these things, confuse the population, get people worried, and if we're thinking about mistrust for government towards Hawaiians for what happened to us, we got to be cautious of others that may have something out for us as a people, right? As we aspire for sovereignty, for self-determination, for uplift our communities, revitalize our culture. So we got to think about that, what's coming to us and who's behind that. But basically, there's a lot of trolls, there's social media, all kind of misinformation. But look to reliable sources, Medscape, WebMD, or Mayo Clinic, for example, as reliable sources. But again, talk to your physician.
How do you, in the medical field, in the healthcare field, how do you determine what is proper research? Like, what are the protocols you go through? I mean, for us, I know that in education, we go through a process of triangulation. What types of process do you guys go through to kind of identify or help folks have a methodology to identify or seek out truth.
Validate information, right?
Yeah.
Similar to what you just talked about, triangulation, different sorts of research methods and approaches to get information, right? So we do a lot of rigorous studies in science, right? We look at the efficacy of vaccines in a controlled settings. Even before it gets there, we look at it before it gets to human trials to make sure it's safe. And then when it gets there, we do a lot of studies. We continue to do studies even after the initial studies are done to see what happens when it gets out to a wider audience, to more patients over time. And we continue to do that. And we do that in a process called peer review. I mean, there's many other experts. And in fact, as you know, as a scholar yourself, that sometimes our colleagues elsewhere can be our biggest critics and judge us really harshly, and rightfully so.
Yes.
To make sure that what we put out
It's quality.
is accepted, it's quality by the peers, other experts, right? And so I think science and scholarship and academics, we hold ourselves to a very high standard. And I think, as you pointed out so nicely in past conversations with you, Kalehua, is that we aspire for our kids to become doctors, scientists, lawyers. And then we want to look at them as trusting experts in these areas.
Absolutely.
So we gotta trust our kauka, our kanaka who are in these positions. So same as what you do in education is often the same things we do in science. And then we also ask people, how was the experience with it? Are you getting the quality of life issues, right?
Yeah.
Is it improving people's quality of life? So there's so much different ways we look at these things to make sure it's working, and working in ways that people want it and want to keep on doing it, right? So yeah, thank you for asking that question, because a lot of people don't understand the process of research.
Thank you for building that clarity, man.